Hello, I want to go through an overview of what the testing scene will look like. So when you walk in the door, you'll come in and there'll be several scenarios blinded on the desk in front of the instructor. You'll just simply tap, pick which one you plan on doing. They're randomized, you won't know which ones they are. And then from there, you'll begin the scenario. In the room, you'll have a bag. It won't be this bag, it will be whatever bag that you're typically used to, with all the equipment you're gonna need to run this scenario. Your patient will be compliant and will be somewhat triaged or moulaged up for you. And then you'll have your skilled partner, which will be a trained EMT who will follow your instructions and help you throughout the scenario.
Hi there. Welcome to your skill evaluation.
Hello.
Go ahead and select which scenario you're going to be doing.
I'll pick this one.
That one? Okay. So, what's your name?
Eric Steffel.
Alrighty. All right, Eric. This is your professional partner. This is your equipment bag. And whenever you are ready, you'll have 15 minutes to complete the scenario. And whenever you're ready, just let me know and I'll give you the information.
Okay, I'm ready.
Alrighty. You are dispatched at 14:25 hours to a report of an injured person. Your scene is a industrial complex. A coworker leads you into the building and you find your patient as they are now.
Okay. BSI, based on this information, I'm going to assume my scene is safe and proceed in. I'm going to take my partner and equipment in with me. And as I approach the patient, what do I see, smell, and hear?
As you see him, he is sitting next to what appears to be some big machinery. He has a towel wrapped around his hand. The towel is soaked with blood, and the patient does acknowledge you as you approach.
Okay. With the blood around the hand, I would consider that a potential life threat, so I'm going to prioritize that. I'm going to come over and introduce myself to the patient. Hello, sir. My name is Eric. What's going on?
My hand really hurts.
Okay. Looking at the blood, is it soaked? Is there a significant amount?
The towel is saturated.
Okay, I'm going to immediately go ahead and place a tourniquet on this as a life threat. Sorry, this is going to hurt a little bit. I apologize. Then I would continue to crank that down and reassess for pulse.
Once it's applied, you do not feel a distal pulse.
Okay, good. All right, so now I'm going to go ahead and continue on with my assessment. I don't need any additional resources at this time. It looks like it's a traumatic patient. I've got just one patient, and at this point, no. I'm going to start my patient assessment. Can you go and get me a set of vitals?
Okay, what set of vitals would you like?
Can you get a blood pressure, a pulse, and SpO2?
Sure. Blood pressure, pulse, and SpO2.
Yes, ma'am. Thank you. Oh, here's the stuff you fix this. All right. So I'm going to start off doing a primary assessment real quick while she's doing that. Hello. I'm going to just do me a favor, open up real big. All right. Airway is open. Mucosal is moist. Breathing. I'm checking.
I'm ready to get your blood pressure, sir.
Okay. Respiratory rate.
Respiratory rate is regular and non-labored.
Okay. I'm going to go ahead and listen when she's done. Circulation. I'm going to have to wait until she's done there.
His skin is warm and dry.
Okay.
110 over 60.
Okay. I'm just going to.
98% on room air, and the pulse was 100.
Good.
You have a strong radial pulse.
Good. And skin's good. I'm going to do me a favor. Can you squeeze my finger here? All right. Good. Can you push down, pull up? Good. Thank you. And one last thing, I'm going to have you just keep your eyes open. And how's pupillary response?
Pupils are pearl at 4 millimeters.
Okay. Now that I can go back and listen to lung sounds, take a deep breath. Okay. Take a deep breath. And one more.
Lung sounds are clear in all fields.
Good. Thank you very much. Okay, so I'm going to do a detailed assessment. Is anything else hurting you anywhere?
Just my hand.
And what happened to when you sustained the injury?
My hand got stuck in the machine.
Okay. Nothing else, no others, and I don't see any other visible bruises or anything like that. Okay, and then how long was it stuck in there?
About 5 minutes.
Okay, just this pain doesn't go anywhere?
No.
Scale 1 to 10, how bad is that pain?
It's about a 9.
Okay, is it staying at a 9 or is it going up or getting better?
It's staying about a 9.
Good. Do you have any allergies, medications?
Aspirin.
And do you have any medical problems?
Hypertension.
Hypertension. What do you take the aspirin for?
I don't take aspirin.
Okay. And last oral intake?
About 5 p.m.
Good. All right, we're good there. So again, no need for C-spine. So we would go ahead and just load the patient onto the stretcher and initiate transport. Once we have secured, make sure he's got secured properly to the stretcher, and I'll continue to reassess vital signs every 3 to 5 minutes. And we're going to transport to a trauma center with a hand injury like this. Here's an example if you direct your partner to do something that you were to be tested on. Okay, so can you do me a favor? Can you put a tourniquet on that for me?
I need you to do that for me.
Oh, okay. I'll go ahead and put that tourniquet on. Here's an example if you accidentally prescribe or tell somebody, your partner, to do something that may be dangerous or harmful. Okay, I'm going to place the tourniquet. Can you do me a favor? Can you give him an epi auto injector for the pain?
Confirming you want me to give him an epi auto injector for pain?
Yes, please.